Hello, I'm Dr. John Lancaster with Chiropractic Partners. I want to thank you for taking the next steps towards improving your health and regaining a better quality of life. I also want to encourage you to watch this whole video. It's only a few minutes long, but if you've got neuropathy or if neuropathy is impacting your life or that of a loved one, then the information you're going to receive over the next couple minutes is crucial, potentially even life-changing. So please watch this whole thing. The mission in our office is not just to manage symptoms. We try to help patients reverse the nerve damage that has developed so that they can begin to enjoy a better quality of life. Now, most of the neuropathy that we see in our office has one of three main causes. The most common cause that we see is diabetic neuropathy, which is caused by diabetes. The second most common cause that we see is chemo-induced neuropathy. And we see this in cancer patients who've been receiving chemotherapy. And the third most common cause that we see is idiopathic neuropathy. Now, that's really just a fancy doctor word for we're not really sure what caused it. But under that category, there are more than 100 different documented causes of neuropathy, including exposure to different chemicals and even to different medications, particularly statin drugs for cholesterol. So when you come in, the first thing we're going to do is determine what is the primary cause of your neuropathy. Now, with all the different types that I mentioned, they all have one thing in common. In fact, almost every single neuropathy patient that we see has some issue with circulation. Now, this is the part I wanted you to watch. This is why I wanted you to stick with me for this whole video. And it's really important that you understand this next concept because it could be the very thing that's keeping you from getting well and staying well. So I want you to imagine that the palm of my hand is the body of a nerve cell, that my fingers here are the blood vessels that are supplying this nerve cell with the oxygen and the nutrients that it needs. Now, what happens in almost all these cases that I mentioned is that these blood vessels get damaged. And over time, they begin to shrivel. And as they shrivel, less oxygen and less nutrients are able to get to that nerve cell. And eventually, that nerve cell begins to die off. Unfortunately, this is the time when most patients even begin to experience symptoms of their peripheral neuropathy, as these cells are already beginning to die off. Now, our focus in this office is to restore proper circulation to these nerve endings so that they can begin to get the oxygen and the nutrients that they need to regenerate and to begin thriving again. Now, as we do this, which obviously takes time, but things begin to regenerate. We have an increase in blood flow. And one day, this nerve isn't getting choked off as much as it was before because it's beginning to receive more oxygen and more nutrients that it needs. And as we continue to do this over time, we're able to fully restore the blood flow back to this nerve cell, at which point the nerve cell can communicate properly with the brain, the central nervous system, giving it the information that it needs to function better and to feel better. That is the goal of this office. This is a missing link. So if you've never had an examination that looks at that, then it's time that you do so. Like I mentioned, that's the focus in our office. In fact, our doctors and our team, we get really excited when patients come in with neuropathy and they actually qualify for our treatment. Because after an examination, we're going to know if this circulation issue is the problem. And if this is the primary root cause of your neuropathy, we feel quite confident we're going to be able to help you out. As I mentioned in an earlier video, we have over a 90% success rate with treating neuropathy right here in our office. And after your examination, we'll know whether or not we can help you. We look forward to seeing you soon. Take care.